Today on CityLine, it's an anti-aging procedure that will take years off your face. Find out why celebrities are flocking to get the vampire facial. That's all coming up right now on CityLine. Here's Tracy Moore.
Like Kim Kardashian have embraced the vampire facial, the latest treatment that promises to turn back the clock on aging. We caught up with a patient who was keen on trying this procedure herself.
Hi there. So my name is Genya. I'm 62 years old and I've been in the beauty business since 1977. I want to stay in it for a while yet, so I want to look my utmost best. And I am absolutely not ready for radical surgery. And when I heard about PRP, it makes crepey areas of the skin soften. I want to get rid of my upper lip line, the mannequin lines here, and I'm game to do that.
Genya is a typical patient who might present in her 40s, 50s, or 60s and would like a solution that's not too aggressive. The procedure we're going to see today is a stem cell therapy called PRP. It's generic and stands for platelet-rich plasma. We take some blood, we spin down and eliminate the cells that, although useful, don't have the growth factors and the stem cells. We're going to put them on her skin. We're going to create little channels in her skin so that little serum will penetrate deeply, and then we inject it under the skin. We surround the skin with healing factors that will augment and accelerate her own collagen, elastin, and good nutrient production. PRP takes about 30 minutes to perform. You see growth of collagen elastin over about 6 weeks. Patients should take a weekend off at least, and they're going to see tremendous reduction in fine lines, textural irregularities, and sun damage. It's been about 6 weeks now since we did the PRP. When were we able to get into makeup and go back to work?
You had told me 5 days, and it probably was exactly 5 days.
Perfect. There's been quite a noticeable improvement in the fine lines and deep lines of the eye and the lip. Do you agree?
Absolutely. It hurt a bit, and I was a little bit nervous. But every single day I noticed that it was getting better. I'm happy I did it. No regrets.
That's pretty dramatic. Oh my goodness. Dr. Steve Mulholland is the one that did the procedure. Incredible the work that can be done through cosmetic procedures these days. It's amazing to see it. So it's called the vampire facial, but this is, you know, sort of just a very sort of a wink and a nod at the fact that you're using blood. You're using platelets, and so you're extracting it from her and putting it back onto her skin.
Yeah, so prior to the procedure, we do a small tube of blood from the elbow where you would donate blood or have blood drawn.
Yeah.
It's then sent off, it's spun down, and the elements that we want, the stem cells and the growth factors, are purified. And so I call it PRP, which is the medical term, platelet-rich plasma, but you know, in the lay press, it caught on as the vampire lift or vampire facial. Vampires live forever with wrinkleless because of blood products. And so we use stem cells and growth factors to put on the skin. That would be the vampire facial, or inject under the skin. That's the vampire lift.
And what Genya had was the facial.
Well, we combined a bit. We create some micro-channeling, so if you put it on the skin, it's got to go in.
Yeah.
And so you create some injury. It can be needles or fractional lasers. And then you put it on the skin, and it sucks up the factors, the growth factors, and the stem cells. And then you can inject some of it under the skin, so you sort of sandwich the skin with these factors that stimulate your own internal mechanisms of cellular rejuvenation. So the stem cells and the growth factors kick in cells that make your skin young. They make new collagen, new elastin. And it really is quite a neat way to amplify the effects of our typical non-surgical treatments.
So you can see the before and afters here that are so dramatic. So this is a little bit from the side. That is right from the front. So she didn't have deep lines. You know, she had sort of little lines here and there. but the difference it made in the smoothness of her skin. And that was just in 5 days?
Yeah, so this is a couple weeks after the treatment, but there's a 5-day recovery period from the micro needling or the fractional channeling that we do.
Right.
So I tell patients there is a recovery. You're going to have some redness and downtime. It can be done under topical anesthesia, so you don't need to have an anesthetic. It's quite simple to do. And then the kind of result, who does best with this? Someone with fine lines, as you pointed out. If they have very, very deep lines, we need to do more aggressive treatments. And people who have sun damage, their skin looks a little brown, discolored, lost its luster, large pores, all the textural issues that we want those stem cells and growth factors to stimulate are what this does great. It's not a facelift in a jar, hence the vampire lift is kind of a misnomer. It gives you a youthful look, but not necessarily a lifted look.
Will she have to go and get this done again to keep those results looking like that?
You know, vampires live forever. The results of this don't.
Right.
And so it's generally made for the living, not the undead. Living, you know, oxidative stresses, sun damage, smoking, weight loss, weight gain, you know, work stress, kid stress, all these stressors play out on our skin. So when you have a treatment that looks great, in general, you need to do 2 to 3 maintenance treatments a year that are mild, or one more aggressive treatment once a year to 1.5 years to keep looking 5 to 8 years younger.
Okay, all right. I want to know how, like, when you're doing the poking, either with the laser or with the needle, is there some pain?
Yeah, you know, I don't like the word pain. I would call it aesthetic discomfort.
Okay.
Meaning that it's...
it hurts.
It's pain in the name of beauty.
Hurts.
So there is some pain, but on the grand spectrum, let's say plucking your eyebrow hair or waxing, this is way, way under that.
Well, waxing what? I mean,
Good point. Good point. Yes.
Some are more painful than others. But okay, that gives us a bit of a threshold as to how it might feel when you're doing that. What about cost?
Yeah,
what are
so
we talking
in
about
general
here?
is how many syringes are drawn and spun down and what kind of micro-injury technique. But in general, vampire facials, vampire lifts, PRP treatments will cost somewhere between $750 for small zone, and it can be as much as $3,000 to $4,000 for a full face and neck. And so in the grand spectrum of comparative cost to more excisional surgery or more risky surgery, it's affordable. There is a recovery. It's not right back to work. You know, 5 days, and the results, as you can see, become quite noticeable.
They're stunning. Just one more thing. Can you do general anesthesia for this? Like, can you actually go under?
Yeah, most centers that, let's say, would be plastic surgical oriented would have an option for IV sedation. I wouldn't say full general, that would be too much, but like the kind of thing you might do if you did colonoscopy, a light IV sedation. But to be honest, most people tolerate quite well topical anesthesia and cold air, which is also used at the same time. Most do it that way.
Okay, because they're focused on that after shot.
Yes.
It's going to look so good. You know what looks really good? Your hair. Who likes his hair like this? Isn't that nice? I really like it.
Thank you.
It's just, I can see the difference from the tape, and I like it short. Okay, well, Dr. Mulholland has brought down a gift bag for everyone. It includes gift cards for treatments and professional skincare products from Vivier and SkinCeuticals. Thank you, sir.
Thank you.
All right, let's go to break. We've got more